you. Good morning. Welcome to the this meeting of the Health and Wellbeing Board. I'm Councillor Simon Jones, Chair of the Board, and I'm obliged to inform you that this meeting is being live streamed and recorded. Members of the public will be able to see this meeting and hear the audio. So in attendance the meeting, if we can do a quick in-depth around the room, if everybody can introduce themselves and their role. Okay, so Penny.
Morning, hi, I'm Penny Bayston, Head of Joint Partnerships, a joint role between Shropshire and Topford and Week and CCG and Shropshire Council.
Councillor Kirsty Hurst, my portfolio holder for children and education.
Mark Brandreth, Interim Council Officer at the CCG.
Jackie Jeffrey, Chief Officer of Citizens Advice Shropshire, but representing the Voluntary Sector Assembly.
Lynn Corley, Chief Officer, Healthwatch, Shropshire.
Good morning, Tanya Miles, Exec Director of People for Shropshire Council.
Good morning, Stuart, Superintendent from West Mercia Police.
Good morning, Rachel Robertson, Director of Public Health for Shropshire.
Morning, Al Cross, I'm a Health and Wellbeing Officer for Shropshire Council.
Right, thank you. Okay, apologies so far. We've had apologies from Claire Parker, and she's asked Julie Garside to substitute. I don't know if Julie is.
I think she's here.
Julie's all right.
No, sorry, Julie's not available, so I'm here representing the CCG today.
Ah, right. Sorry. Thank you. John Pepper.
John's joining us virtually.
John's joining us virtually. Yeah, hello, John. Patricia Davis. Angie Wallace. She's no longer with SAF, so there's no SAF rep. And Louise Barnett's PA has she responded with regards to a SAF rep?
Yeah, they're currently looking to have a representative on the board when she's coming back to me.
Lovely, thank you. Item 2 on the agenda is disclosure of pecuniary interests. Members are reminded to disclose any pecuniary interests in any matter to be discussed which is not included in the register of interests, and leave the meeting prior to the matter being discussed. Are there any such pecuniary interests? No, thank you. Third item, minutes of the last meeting, and what I'll do is I'll just go through the if I can get my mouse back. No, I can't. I'll just go through the pages. Page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8, page 9, page 10, page 11, page 12, and page 13. And I have those minutes have been circulated, so are we all happy that I sign those as a correct record? Is that seconded? Fine. Okay, I'll now accept these minutes as a true record unless anyone indicates differently. Item 4 on the agenda is public question time. We have one public question which has come from Shrewsbury Friends of the Earth, and I'll read out the question. And I don't know, Rachel, do you want to read out the response as it's come from you and Les, or do you want me to read the response? Okay, the question from Shrewsbury Friends of the Earth. Would the Health and Wellbeing Board adopt a proactive stance and push Shropshire Council to do more on air quality improvements and ask for regular updates and review on progress? In order for the reasons we are asking the question to be understood, it is necessary to include some background information. As far as we can tell, in the last 3 years, there are only 2 mentions of air quality in the agendas available for the board, dating back to January 2019. This is despite the recognition that air quality has an impact on health and well-being, and that the Health and Wellbeing Board strategy at the time recognised this. The first is this extract from the minutes of the Health and Wellbeing Board, the 16th of January 2020. Healthy Lives Update Resolved B. The ongoing prioritisation and work happening, which includes wellbeing support, suicide prevention, county lines and air quality, be recognised. The second mention was in the agenda items from September 2021, where the Shropshire Council officer was proposing action at the Shrewsbury station AQMA. The latest Health and Wellbeing Board Strategy 22-27, page 11, notes the impact of air quality on health, and yet there is no mention of it in the report on it produced for this meeting. It was therefore not deemed to require greater significant reference. Air quality has been illegally high in Shrewsbury and Bridgnorth since 2010. All the annual reports on air quality have recognised the effect on health and that any pollution is bad for health outcomes, even when it is below legal limits. Shropshire Council air quality reports since 2017 have proposed consultation. The one Shropshire Council proposed action in the September meeting said that consultation had taken place, yet the action was not endorsed and deferred for more consultation without a deadline. We are now into March. There is no item on the agenda and seemingly no action to report is available. So now the response from Les Bursgrove, Assistant Director of Health, Environment Protection and Healthy Place, and Rachel Robertson, Director of Public Health. Okay, Rachel.
Thank you. So it is correct to say that there are 2 very localised areas in Shrewsbury and Bridgnorth that have been affected by levels of nitrogen dioxide above the nationally set objective levels for some years. The regulations in force during this period state that councils should be working towards taking measures to reduce levels. It is also true to say that there is no completely safe level of this pollutant, but its presence is unfortunately a byproduct of modern society with all of the activities such as the use of motor vehicles that is accepted. The action you are referring to is as being consulted upon was the idea of a trial lane closure within the air quality management area in Shrewsbury. The latest position with this is that the potential intervention, along with other various ideas, will be looked at through the development of an options appraisal as part of a creation of a new air quality action plans covering both air quality management areas. It is an intervention. If the intervention of a lane closure is modelled as potentially being worthwhile and appears in the air quality action plan, then consultation could then take place. The main purpose of the report for the 2022-27 Joint Shropshire Health and Wellbeing Strategy, which is referred to, is to highlight key changes, additions to the final strategy following the consultation process. As air quality remained, this is why it was not specifically referenced. It certainly merits significance, and the report which came to the 8th of July Health and Wellbeing Board meeting stated other focus priorities remain as agreed at the 2019 workshop: social prescribing, domestic abuse, county lines, alcohol, smoking and pregnancy, food insecurity, suicide prevention, killed and seriously injured and on roads, and air quality. Although these are listed, they should not be considered as separate priorities and will form part of the key strategic priorities above. The next stage of the strategy is implementation. The Health and Wellbeing Board forward agenda planning will ensure papers relating to these specific priorities, which includes air quality, will be brought to the meetings to provide updates and review progress.
So the response from the Shropshire Health and Wellbeing Board, the board agrees it will adopt a more proactive stance, and air quality will be on the agenda for the next meeting, which will be in May or July. Okay, you've been happy with that response? Thank you. So now moving on to item 5. So the first item is the ICS involvement strategy presentation. If I can invite Kate Manning, who's online, I believe. Yes, Kate, if you can present you can present your item to the board. Okay.
Absolutely, no problem. Thank you very much. Okay, I'm just going to attempt to share my screen. Can everybody see my screen okay? Okay, fabulous. So first of all, I'm Kate Manning. I'm the Senior Engagement and Communications Manager within the CCG. I'm standing in today for Edna Bowenpong. Unfortunately, she couldn't make it. She's in interviews all day. But I'll take you through this presentation, and if you've got any questions at the end, I'll attempt to answer them, but if not, I'll take your questions away and I'll come back to you. So this slide, it briefly describes the system and what we mean by the ICS, ICB and the Integrated Care Partnership. And I'm sure you're all pretty familiar with this. So I'll move on to the next slide, which talks about our associated work, which has been developing around involving people and communities. So the Integrated Care Boards, as part of their constitution, are required to develop a strategy which sets out their intentions and the approach to involving people and communities, and this needs to be done by the end of May this year. However, whilst this is something we're required to do, it also feels the right thing to do and at the right time, when our intention is to work more collaboratively as a system, and that means both with our partners and with our communities. Involvement should play a strong part across the different areas of the integrated care system, and integrated care partnerships and place-based partnerships should have representation from people and communities in setting their priorities and in decision-making forums. Integrated care partnerships and boards are expected to use insight and intelligence about what people need and their aspirations to support decision making and service quality improvement. So this work, it isn't a starting point for us in Shropshire, Telford and Wrekin. So last year, I'm sure you're aware of the work that was undertaken around the voluntary and community sector memorandum of understanding. That was developed in partnership with the sector, and conversations also began around making involvement and co-production everyday business. So those discussions that started last year and the opportunities to build those relationships and learn from different organisations and partners across the system as to what was already working well has helped us to shape 10 draft principles that will sit at the beginning of this strategy. So these are the draft principles, and yesterday we held a workshop with partners from across the system that included partners, project leads, commissioners, engagement leads, voluntary and community groups and patient representatives to test these principles and also shape our approach to involvement, which will help inform our strategy going forward. So in terms of the proposed next steps, we're continuing, and we have been over the last couple of months, speaking and reaching out to public and also different groups within communities to find out and listen to them about their experiences of getting involved and how they want to be involved in the work and the future of the integrated care system. We'll also be collating everything that we heard at the workshop yesterday and asking those that attended to just make sure that what we heard from them is right before it informs our strategy. So we want that to be a continuous, ongoing engagement process. We also propose to organise a further workshop to really get into the how we put our intentions into practical terms. The national deadlines that we're working towards are quite tight, so we need to have the final draft of the plan ready for submission to NHSEI by the end of May. So we're hoping that we will have a draft of the strategy to take to the CCG board by the end of April. And that's the end of my presentation. So I just want to invite any questions or comments on that.
Thank you, Kate. Are there any questions at all or comments on Kate's presentation? No, so oh, sorry, I beg your pardon.
It was just a couple of kind of comments and observations to draw out. So I think obviously really welcome the paper and welcome the engagement and the kind of direction of travel. And I think it's really obviously important work that absolutely engagement has to be at the heart of everything that we're doing, particularly in the new ICS. And I know a lot of people in this room have been involved in that process. I guess it's just, as we move forward as well, it's just thinking about how we engage people who are representatives of their communities as well as the communities themselves. So thinking about some of our parish councils, some of the members around this room, and I guess businesses and workplaces and others who represent parts of our community. And I think, whilst I appreciate the drive is definitely towards communities and individuals, absolutely support that in co-production. I think there's also that element that we just need to make sure that we bring into this. And the other thing was really, it wasn't particularly related to the engagement part of work, it was just flagging the second slide around integrated care partnerships. And I think, I know we're discussing that, and many people in this room are involved in those discussions through the SHIP and through the integrated care partnerships, but also to flag for this board how important that work is, that we've had the new guidance out around integrated, the white paper that's just come out around integrated care systems, and I think the role of the Health and Wellbeing Board within that is really important. So I think we need to have more discussion around that at the board at some point. So just to kind of flag that at this point. But
Thank you.
Thank you, Rachel. Right, if there are no further questions or comments from members, we'll accept the report. I don't think there were recommendations on it, were there? No. So we'll accept that report. So thank you very much, Kate. Moving on to, as you sort of mentioned it, Rachel, Shropshire Integrated Place Partnership. I'll move on to Penny to present her report.
Thank you, Chair. I shall attempt to share my screen. So yes, the Shropshire Integrated Place Partnership. So just as a reminder, it's been a few months since we had a presentation or an update from the Integrated Place Partnership, partly because of winter pressures. We did stand down a couple of meetings through December and January while the system was grappling with significant issues. So we are in a place where we're catching our breaths a little bit around the Place Partnership, and so it's a presentation today as opposed to a paper with recommendations. I just wanted to put this slide up, which was a reminder of kind of our ethos, how we're working, how we want to support through the Place Partnership, that essence of self-care and support, but we need to facilitate that as services. And a lot of our work goes into that, but also into when people need services, that they're able to access those for their health and wellbeing needs. We have used the health and wellbeing draft priorities from the Health and Wellbeing Board strategy as a focus of the SHIP priorities, but also the priorities of the ICS and those key areas of work that the ICS are delivering. So there's real crossover with what we're doing here at the Health and Wellbeing Board, what the ICS is doing, and how SHIP delivers that on the ground in the local place in Shropshire. We have a number of subgroups as well. I also just wanted to flag up that the health and wellbeing strategy, I think, is coming to this board today for ratification, and as such we'll just take a look at the updates that were made following the engagement around the strategy, around the key focus areas, and just see if we need to make any adjustments within SHIP and have that conversation there, but that is work to be done. Our terms of reference as well, we had a good discussion at the last SHIP meeting around the terms of reference. We feel that those terms of reference are okay. They're a bit of a holding place, but as the guidance comes down around how we develop our ICS, how the ICB and how the ICP, the partnerships and boards develop, SHIP will need to adjust its delivery and its terms of reference in accordance to what is required and the guidance that comes down from NHS England. So we're very much on, we'll be on top of that as the guidance comes down, and as we work with, as Rachel's already mentioned, the white paper and the recently published white paper. One of our key areas of focus is local care, and local care has a number of strands. I just wanted to focus on this strand for the board today to let you know that there is good progress being made with rapid response. So one of the key areas of work for the ICS is to have more care out of hospital, make sure that people in their communities and in their homes can be cared for as much as possible. And after good success in Telford and Wrekin and a pilot in Shropshire. Rapid response is being rolled out across Shropshire. It's an enhancement of the model that was trialled in Telford, and it looks at a crisis response, so within 2 hours, multidisciplinary health and social care teams supporting people at their homes, and also with urgent care so that they can remain in their usual place of residence, which may include care homes. So we've had implementation of SY1, SY2, SY3, SY4 and 5 in sort of January, February, and moving to Northeast and Northwest in spring and summer, and Southwest in June. So there's good progress being made there. With regard to personalisation, which is another part of our local care programme, personalisation is personalised care, I should say, is a cornerstone of NHS England long-term plan, and it's something that certainly the voluntary sector and the public sector, the council, can really recognise around taking a personal approach to how we deliver what we do. But in order to do that and sort of shift thinking within services, there's quite a strong programme with not a huge amount of money, but a bit of money attached to encourage training, to encourage new ways of working that really focus on individuals and individuals' strengths, and taking that strength-based approach and what matters to them. So we've got some specific projects happening in Shropshire, Telford and Wrekin, and these are around asthma and mental health, for young people in particular, asthma and mental health. We're using co-production to really understand what we need to deliver across all of those programmes. And social prescribing sits within personalisation as well, but I'll come to that in a bit. And the workforce development, I think it's important to note here that I'm not sure this is replicated elsewhere, but we have a real focus around the workforce development and training being available and open to all. So it's open to all voluntary sector, it's open to all social care, all public services. So and the key areas of development there around shared decision making, motivational interviewing, behaviour change, and health coaching. So looking at that much more at social need and supporting people to support themselves. So prevention, just wanted to highlight to the board that we have commissioned a Tier 2 behavioural service for weight management. That started in February, and we're using the funding as long as we can. So the last intake is currently going to be the 31st of March. That's open to all primary care referrals. It's we're hoping to hear that more funding will be made available very soon, in which case it will carry on beyond that. And we're also looking to enhance that with a Healthy Lives lifestyle offer going forward. So, and that's something that will definitely be available, but that's being scoped and worked on at the moment, particularly around weight and smoking. Social prescribing is delivered across all practices in Shropshire with really, really good outcomes, and I noticed that we've included the outcomes around that in both the in this report, so I won't go into great detail, and in the report of the Joint Commissioning Group. But we also have a pilot happening in the southwest of the county with really positive results so far around that, really understanding what the needs of children and young people are, taking a two-pronged approach in the southwest. One is having a one-to-one link worker offer for children and young people to have that one-to-one support, and the other is the kind of additional activity available for young people with a wellbeing approach. So where people have, where children and young people have they get to take additional activity, but also those delivering that additional activity recognise the need to support their resilience and their mental health in particular. So I'm just going to skip through these, but just to show we have good referral rates for the year and increasing, and so these show, sorry, got a bit excited there. Yeah, and it sort of demonstrates the referrals by practices, but also we take referrals from outside GP practices as well. This demonstrates our data, which shows us whether or not we're doing a good job. So when people's reduction is good, as it says there, so we take an understanding of people's concerns, and then on a follow-up we understand if their concerns are less or more, and you can see there that they're less for the most part, which is good. And the same with using the ONS measures, so our life satisfaction, anxiety, and how happy you feel. And again, The top three, an increase is good, and the bottom one, a decrease is good. But these will be circulated for people to look at in more detail. And as Rachel said, involvement is really important to SHIP, and we've been working closely with the ICS around that involvement, and developed the second of the 3 workshops that have already been in place. And the outputs of the workshops that have happened, again, these haven't, the SHIP haven't delivered these, it has been the ICS, but has been a memorandum of understanding with the voluntary sector, principles of involvement, and then of course there was a workshop yesterday, some more work, as Kate talked about already, will come from that. And just finally to say there are developing programmes of work that we'd like to bring back to the board. Again, these are linked with the joint commissioning group, joint commissioning paper that you'll see next. Children and young people, so some specific work there. We are working on the metrics for SHIP, which really need to dovetail with the metrics for inequalities and the Health and Wellbeing Board. That's a work in progress. We will receive and have received and will continue to receive reports at SHIP around mental health and dementia, and end of life and enhanced health and care homes as part of the local care programme as well, which I'd be pleased to update the board another time on.
Thank you very much, Fanny, for that. Just one question from me. You mentioned with regards to CIP and asthma. I just wonder if there's any intervention with regards to diabetes. Or am I asking a silly question?
For children and young people?
Yeah.
No, I think it's a really good question. So there's work going on at the moment that's connecting with, as a system, we were asked to look at what we delivered around weight management programs, and we're doing some work as a system also to look at how that connects with diabetes. And we've had, so there is work happening in the background, but there's nothing I can report specifically today. It's not currently part of the personalisation program, but we are encouraging clinical staff and all staff working with children who, all people who are on the diabetic register, to undertake the personalisation training, so that what matters to them approach. So it's in development, but I can't report anything specific today, but I think it's a really important one.
Oh, thank you. Right, are there any questions at all? Yes, Cecilia?
First of all, Chairman, can I apologise for being late? I got stuck in a traffic jam, the like of which one seldom sees in Shropshire, but there was I sitting in the middle of it, so I do apologise for that. Can I please ask some really basic questions, and will you forgive me if I do that? First of all, I'm interested to know what you mean exactly by the southwest of the county, and I'll tell you why. Because I regard the southwest as the sort of the west of the A49, if you like. Now, my patch is just east of the A49 and shares an awful lot of characteristics with those areas to the southwest. So I'm quite keen that southwest doesn't exclude parts of the more southeasterly area as well, which covers a huge sort of rural area which goes all the way around the Clee Hills, Brown Clee. So could I have some reassurance on that? And the other thing that I'm very interested in is, are we happy with, and excuse me if this is a basic an ignorant question, are we happy with the resilience of our GP practices? Because there was certainly concern earlier about the fact that some of the, and again, this was in the southwest area, there was certainly concern about the fact that it looked as though some of the GP practices might be vulnerable, might not have enough doctors, staff. Are we happy now that they can actually deliver on these programs effectively because they are, they've got the staffing they need?
Thank you. Okay, is it possible for me to answer question 1 and then ask colleagues to answer question 2? I know we've got Dr. Pepper on Teams, and we've got Mark Randolph here. So if that's possible, because I can't answer question 2. With regards to the southwest, southeast, I understand what you're saying completely, and I think that there is, people are people and communities are communities, and we might draw a line down the middle, but people don't necessarily. Yeah, so that totally makes sense to me. We are delivering service, but at some stage to carve up and deliver services, we do draw these lines. With regards, when I talk about the southwest, it's generally in line with the primary care network.
which is sort of, like you've said, down the A49 and then west, and takes into account those GP practices in that area of work. But we aim to deliver our work across all of Shropshire, so we don't want to make those, but sometimes when we start with pilots, as an example like there with social prescribing, we've done it in that particular area because it's an area that the primary care network was keen to have a social prescribing young person lead, and it was an area that the data said we needed to do something about, in particular young people living in those rural areas. So I understand what you're saying, and I think we need to be mindful of that all the time in the services that we deliver. But we are trying to follow some methodology behind developing and delivering services. Does that make sense?
Yes, it does. I think my concern is that we have GP practices in Ludlow, we've got GP practices in Craven Island and Church Stretton. We've got nothing in the rural hinterland until you get up to Ditton Priors.
Yeah.
And then there's a practice up there. Now that actually covers a big area, yeah, as you can imagine. And that's really why I asked the question, because it seems to me that I know that the Ludlow provision is extremely good.
Yeah.
And the Craven Arms provision seems to be good as well. But it's more about what's going on in those rural areas and their access problems, which does concern me and always has done actually.
I agree, and with transportation as an example,
exactly,
it's coming up time and time again around children and young people in particular. So and I think we can't differentiate between, you'll have the same issues like you say in your very rural constituency as we will do in the very corner of the southwest. So,
yeah, sure.
Yeah.
Yeah.
Thank you. And partners to answer part two.
And forgive me, partners, for asking, as I say, basic questions.
No, sorry, do you want to just ask it again?
Yeah.
I was listening to Penny's very good answer on the first.
I was particularly thinking about the resilience of GP practices within those very rural areas, or those GP practices that tend to be based in town, but are having to deal with very wide catchments. That's probably a better way of putting it.
Yeah, I actually don't see the resilience question as urban and rural, I'm afraid. I see it as I'm really worried about primary care and GP practices.
No, that's fine.
So,
I'd be happy with that.
There are significant issues with the attractiveness of primary care, and particularly being a GP as a profession.
Yeah.
We are in a very competitive market. We don't have enough GPs. We don't have as many as we'd like. Enough haven't been trained over the last probably 10 years. There's a lot of work going on around the wider primary healthcare team. So one of the things that we're very keen to do is to help patients understand that perhaps seeing a pharmacist, a nurse, a physio is not second-class treatment if you've not seen the doctor. I always go back to my old gran. If she went to hospital and didn't see the professor, which is often a man, I have to say, if you didn't see the professor, it didn't count. You know, it's attitude of a particular time, which is I refer to my own family in that. So there's more work to be done with patients to help them understand that, because the patient experience when they do receive that kind of care is very good. But sorry to kind of I'm not avoiding your question, because we do worry and we do think a lot about rural deprivation and rural inequality as well as urban inequality, so please don't think we don't. But the wider general practice point is a much more concerning point about all general practice as opposed to kind of particular issues. There's some we are very fortunate though in saying that in Shropshire's Health and Wellbeing in terms of the quality of the primary care that we've got. And if you look at the CQC view of that, and it's only one measure, but actually the quality of what's provided is very good. And we need to keep building on that. But to make my point again, I am very worried about our GPs, the pressures on them, the attractiveness of those roles. And if we can't, and this isn't a local point, I make this as a national point, if we can't make primary care more attractive for doctors to come into and work and stay in, we are going to end up in a real mess in terms of the way that NHS care is provided.
Yeah. Sorry, Chair, just if I could just add to that.
Can you use your...
Yeah, sure. Sorry. No, I mean, one of the reasons why I brought this up is because we have such a large elderly population in those rural areas, and it's for them very often access is difficult, you know, because then some of them may not be able to drive cars or may not have cars, and there aren't, as you know, very many other alternatives for getting oneself around in those rural areas. So that's why that's really was at the root of my question, and I should have mentioned that before.
Yeah, I mean, so I would agree with your point, but again, I'd probably counter it by saying we're worried about access right across the county, both urban and rural. I respect your point about, particularly if you need a face-to-face appointment, then access can be an issue. But I think we probably also agree that making an appointment, getting through on the phone is an issue, both in urban practices and in rural practices. And again, that's something that we're working really hard on. I mean, the pandemic has brought forward, I mean, things like telephone appointments 2 years ago, they weren't rare, but they certainly weren't as common as they are now. Actually, the patient satisfaction around telephone appointments is incredibly high, because it means often people don't have to travel for a 5-minute appointment, sit in a waiting room full of lots of other ill people, and we knew through the pandemic ill people with COVID, and actually people being sorted out efficiently, clearly and well. So thankfully the telephone appointment system is here to stay, and we need to keep building on it, but we need to make sure that we're not creating a digital inequality by doing that. So it can be managed with some thought. We are seeing the number of face-to-face appointments begin to return to pre-pandemic levels, but I'll just add that on top of that, GPs are doing more virtual telephone consultations than ever before. So the actual number of appointments that we're operating across the system is way more than we were doing even 2 years ago, which is back to my original point, which is sitting in a room on your own or with people coming in every 5 minutes all day is not terribly attractive medicine often, and so we've got to try and strike this balance. So you make very good points, but there's lots to be done, but I think it does need to be done very thoughtfully.
Thank you, Chairman. I apologise for taking up so much time.
No, that's okay. I don't know if you want to bring John Pepper. John, if you've got any comments at all that you wanted to make on that?
Yeah, thank you, Chair. I mean, not wishing to repeat everything that Mark said, which I totally agree with across the board. I mean, what I would say is that I'd agree that in terms of the original question as to sort of workforce and concern of GP numbers, I think this is not just an issue for our CCG, it's a national issue. You know, we've seen a drop in the total number of full-time equivalent GPs over the last 5 years. And I know that what I would say is that locally there's a big effort to try and support the workforce. I know that the primary care team in the CCG, for instance, does a lot of work to try and support, to encourage retention of the workforce locally. And also practices are now increasingly working together across primary care networks and involving other professionals, employing other professionals to help support really the workload that would have otherwise traditionally fallen simply on the shoulders of GPs. The workforce that delivers primary care is now much broader, and I think that hopefully will go a long way to supporting the sustainability of primary care, given the current pressures that Mark's very eloquently described.
Thank you.
Thank you. Right, thank you. Okay, if there's no further questions or comments, again, I accept the paper. We're happy to accept the paper that Andy's just presented. Thank you. Moving on now to the next item is the Joint Commissioning Board Better Care Fund, and this paper will be presented by Laura Tyler, LT. The floor is yours.
Good morning all. I'm Laura Tyler, Assistant Director for Joint Commissioning, so I'm going to take it through. Do you want me to show that? Has everybody got a copy in front of them, or is it better if I share?
I think if you share, because anybody online you know, if they haven't got a copy, they'll be able to see that as well. Thank you.
I can do that. So presenting an update on the Better Care Fund and some of the joint commissioning work that we've been doing certainly over the last couple of months. So the report today talks about the approval of our Better Care Fund plan that we presented back in November, talks about some of the work we're doing in relation to some of the system pressures and collaborative response to ensure flow through the hospital. An update on some of the work programmes that are going through the commissioning delivery group as we speak, and some of the work that Penny will pick up a bit later on in the report around the progress on prevention and early help work, and then again picking up on some of the social prescribing and some good news around how that's working. So today, just in terms of an update on the Better Care Fund, Better Care Plan. Many of you will remember we got the plan for approval back in November. Seems like quite a long time ago now. That has subsequently received approval in January. We discussed the new metrics that were part of the new plan and looking at how we set those targets. So at the moment we are still awaiting the outcome of where we are with them, but I suspect we will be difficult to meet those, but we described that, I think, at the previous meeting, the difficulties around setting new metrics on the unknown at the time, and then we had a little thing called Omicron in between, so that certainly has played a part in on those targets that we'll see at the end of the year. So just in terms of where we're moving to next with the Better Care plan, I went to a regional meeting probably a couple of weeks back now. We are hoping that we will have some oversight and some updates on early in the new year. So rather than have the framework in November, which is what we usually get, so it's always behind, we're hopefully going to have it in advance, but we'll see where that goes. On that, there was a lot of discussion around what Section 75 agreement was going to look like. The plan at the moment is that there will be a new Section 75 template which will come out. So we will keep an eye on that, and then there will probably an update will come to a future Health and Wellbeing Board. Just in relation to system pressures and response, because that has been obviously a lot of the focus and targeting of the areas of our teams at the moment. And so we know we've seen significant challenges across both health and social care to ensure system flow and discharges from the hospital. So the team have been working really hard to support system escalation calls, working across 7 days a week, supporting those bronze, silver and gold meetings to ensure system flow. We've just made reference to there across the workforce pressures. Again, you know, I think picking up on some of the points already made around some of the workforce pressures in right across the different areas. And again, you know, Omicron really pushed, you know, and increased those pressures during November onwards. And we are starting to see certainly some blue sky now, and things are starting to improve. I have to say, whilst that has been particularly difficult in terms of the challenges around capacity, and obviously the mandatory vaccinations, which at the time of was in place and certainly would have been coming in this year, thankfully that has now stopped. I have to say, you know, considering these challenges, you know, the team have gone above and beyond to ensure capacity has always been available and that we are supporting that flow, thinking very creatively, looking at how we increase capacity across the domiciliary care, looking at different models and approaches, and certainly working incredibly hard. So I do want to formally put on record how hard the teams have worked to support that. There's a lot of conversations now about what we do and what that modelling is going to look like moving forward. So we're working certainly across the system on that as we speak, and thinking very differently and creatively, and thinking about how we will meet challenges moving forward. Just to say, as part of that, you know, we've got a really good system in terms of the voluntary and community sector supporting whether they're preventing admissions in the first place, admission avoidance, or supporting discharge. We've got several projects there. We will be reviewing those in light of what we do for next winter, and certainly how we engage and support and have the voluntary and community sector supporting the system. And again, putting on record a huge thank you for the work that they do. They're an incredible contribution from that system. We've talked about some additional, we've put additional resources to support it. We've moved a heck of a lot of resources actually to support discharge and step down provision, including across our starts teams and social worker at the front door, etc. So we're looking at what works and thinking about what we do in the future, as I've just described. Just in terms of joint delivery group updates, we've got a number of projects that have been coming through that we put out to commission, or certainly will be. One is our independent living service, so we're looking at recommissioning that on a short-term basis and aligning that with several other projects that will come on stream later on next year. One of the things that we're doing around the joint commissioning approach is very much thinking as a system how we can align health and social care projects, commission services, to ensure they're efficient and effective in meeting the needs of our communities. The other area we're looking at, so we've just approved a recommendation of a recommissioning of a local learning disability care home contract, so that is currently out. And also we're looking at how we work is underway to scope out potential delivery models to recommission Healthwatch, which is obviously a statutory service, and looking at some early stage conversations with stakeholders certainly taking place over the previous months and certainly the coming months about what that could look like. So that's quite an exciting piece of work. And then finally, really, the joint commissioning delivery group is also looking at the development of a market position statement. And so for Shropshire, we have currently got a market position statement, and for those of you who don't know what that is, it's basically a position statement to inform our trends, demands, and our commissioning intentions and models moving forward. It's very much written for our providers and gives them an insight in terms of what we want to do as we move forward, and where the demands and trends we think and the models of approach that we think as a system we want to see put in place. So that's really quite a large piece of work and quite an exciting piece of work, really. It will be very much a system piece of work, and so we'll be setting up various workshops looking at what that might look like. So the idea at the moment, we are working to a timescale of September, and that, along with the fairer cost of care exercise we've got to do with the market, both have to be complete for September 2022. So there are quite short timeframes on that, but we are looking at progressing that at quite a pace. And also, as part of that, we will then pull out some of the key elements and look. We're working with Telford and Wrekin local authority, and obviously CCG, to have an overarching ICS market position statement, which again is really good and I think is really timely. Penny, do you want me to hand over this to you to do this update?
Sure, thank you. I'll take this as read for the most part. We have talked about social prescribing already, but this is an important piece of work that, as it says there, there's senior leaders have got together to discuss in the wake of COVID how we can support our young people better. And there is some, we've started out by having a number of workshops, and we actually had this week on Tuesday another really positive workshop where we're really starting to form ideas around that best start in life, supporting schools, triage, and stepping stones, which is around social care in particular. But also recognising that we need to broaden those workshops out to involve more of our health colleagues. I think we really wanted to get to grips with education, our early help offer in the local authority, and also what was going on around prevention within public health and social prescribing. And now we really need to kind of look at, well, there's a range of opportunities around these areas of work, and actually, in order to make the most of those opportunities, we need to make sure we're working collectively as a system with our really much more closely with our NHS colleagues. So it would be good at some stage to bring a more detailed report to the Health and Wellbeing Board, but I don't think we're quite ready for that yet, with sort of more details around that, some of that planning. Thank you.
Thanks, Penny. Just in terms of some risks and opportunities, obviously, we're looking at reviewing the Better Care Fund and what that's going to look like in the future. We don't know if nationally they will change that. We suspect not, but again, we're just waiting for further information on that, and obviously report back once we know a bit more a few more details around that. And I always said, looking at what the new metrics will look like, and the implications of anything new that will come through. On the report, we've just put around the just some of the information around the funding available on that. And that is it from me, really, unless anybody's got any questions. Just a whistle stop tool.
Right, thank you then, and Penny. Right, do we have any questions at all? Yes, Tanya.
Thank you, Chair. Just a few comments, if I may. So first of all, a huge thank you to everyone involved in the response over this last winter. It's been an incredibly challenging winter from our community, and on record, a heartfelt thanks to everybody that has worked above and beyond in supporting our residents of Shropshire. It's great to see the update on CYP and social prescribing, so thank you for that. I think it would be really good for the next Health and Wellbeing Board Chair to have a paper specifically on CYP and social prescribing. I'm interested also about how we interconnect this wider as active housing colleagues, just thinking around asthma as an example, in terms of how we track back to children in particular that have got asthma and their living and housing conditions. It's great to see the progress on CYP and prevention and early help. It's an area that I'm very passionate about, and I know as a Health and Wellbeing Board we've talked about at great length. So again, it would be really important for this board to have regular updates in terms of implementation. And then finally, pilots are great, but I'm interested about how we upscale that pilot so the whole of the community of Shropshire benefits from this great work. So thank you.
I don't know, was that, did you want to respond to that? Sorry? Laura, sorry, not Liz. Yeah, Laura. Okay, do you want to respond to that?
Yeah, absolutely, and I absolutely agree with what Tanya said, and I think there's a real much more joining in particularly around children, young people and adults. And I think that's, we're very fortunate to have a newly formed People's Directorate. Part of my role is around aligning some of, especially the children and young people's commissioning areas into, and having that unified and joined up. And I think the work that we're doing across with Penny and the team is really positive. I think there's some really good conversations around that, and also starting to link in very much within the housing as well. So thinking about what the needs are and future planning around that. So there's a lot of work ongoing with that. I think specifically the pilot work is probably Penny's area within the social prescribing bit, but I think once we get to a point where we're seeing some really good outcomes on, we're looking at what that model is going to look like across the county. Unless Penny or Rachel want to comment on that.
Can I just come back on that?
Yeah.
Just to say, yeah, I totally agree, and we'd love to see a county-wide. The idea behind the social prescribing in the Southwest for children and young people was testing to see what would work. We have a really successful adult programme, and we weren't sure, because we hadn't done it before, what would work for children and young people. So it was important to start small, and we have some really good learning from that. And the thing that's exciting about it is that it has a totally joint effort between the NHS, the voluntary sector, and Shropshire Council. So that is great. That's really exciting. But then sometimes to move things forward and develop them further, you need agreement from all of those areas as well. So so it makes it slightly more complicated. So asking for any influence any of our Health and Wellbeing Board members can bear on taking that social prescribing model elsewhere.
Okay, Rachel, you wanted to.
Thanks. Yeah, I guess my comments were related. This is a really good specific example, but it was just generally there's some firstly to echo Tanya's point about how hard everybody's worked over the winter and how everybody's pulled together across and worked in such different ways, and worked 7 days a week, not just in response to Omicron, but just winter pressures generally. So a huge thank you to everybody. I think there's a huge amount learned from that, and actually we'll be in next winter before we know it, unfortunately. And we expect when we come back and look at COVID, flu, everything else, unfortunately next winter, and I don't mean to be the bearer of doom, will probably be much worse. So there's an awful lot we need to put in place now, and there's really good programmes in here and work that's been put in place, the partnership work and the 7-day working, the voluntary sector work, but all of this needs to be resourced properly. And I think we need to have some really honest conversations, and the social prescribing pilot's a good example, where we're trying to collate evidence to show that these make a difference. And we all know, and we've said as a board, prevention is a great thing to do. Early health intervention is much better to do, but that does require a shift, and we collectively as a board, that's a really big challenge, but we do need to look at how we invest in that. And I think the pandemic's unearthed a lot of challenges for us, and these are the difficult questions we need to look at. So looking at the paper that Laura's put together, the really good examples are in that. How do we get ready for next winter, and how do we really start to invest in some of this? So I think we are looking to try and do that. We're trying to collate the evidence to show what works, and we need to learn very quickly from what does work. And then, as Tanya said, how do we upscale that? And it's not just for one organisation or one part of an organisation to do it, it's how we do it together.
Mark, you indicated.
Thanks, Chair. Just 2 quick points, really. First of all, to extend Tanya's thanks to the team, personally to Laura in particular, who's been a stalwart right through what's been a very long winter, and I know it's not over yet. But Laura, just from the health system, to say thank you so much for your really hard work, often what's been over 7 days a week. And I know you sit on top of a very good team of colleagues and people that work for you, but from us, thank you very much. The second point actually is building on something that's been said already, which is particularly about some of the issues that we faced this winter in terms of the care home market and the domiciliary care market in terms of its resilience. And it's been a very, very difficult winter for staff absence, and facing the kind of triple threat of the usual winter pressures. One, COVID. Two, by the way, it's not gone away yet. We've still got lots of patients in hospital with COVID. COVID too, and staff absence, which I have to say was really probably the most difficult thing to deal with, because however creative and flexible we all are, if there are no people, then there is no service. And we forget at our peril, as we talk in our jargon, and I do this too, that pretty well everything we do as a health and care system involves people providing services and care to other people. So I would really like to take Rachel's point on and echo it in terms of, I think by the time we get to the next Health and Wellbeing Board, and certainly the one after, we need a really robust and clear set of agreements between us about how we're going to approach next winter. Given the Director of Public Health just made some very clear statements, which I totally echo, about beginning to already worry about next winter being potentially worse than this. And Rachel, I really do agree with you. I think the evidence points to that. One of the things that I think we do need to think about is our willingness to intervene in a market, in terms of the care home market, and how we might think about that. I don't mean at the detriment of the providers we've got some very, very good providers, but how do we really support them so that we can continue to keep flow? And finally, I'll finish with this, Chair, which is just to make the point. The reason why we can't sometimes get people into primary care or significantly collected, picked up, cared for by an ambulance or offloaded at hospital is because the hospital is full. The hospital is full because the community services are full and the community hospitals are full, because the care home market, the domiciliary care market is saturated. This is a really complex chain, and we need every part of it to really think differently. And so I think there's a really interesting thing for us to work through in terms of what I'll use this language again, our level of intervention might be, particularly as we face homes and services closed with infection and staff risks. So I think there's one for us there to really work together on. But again, thank you to Laura for hard work. Thank you.
Thank you. Right, John, did you
Yeah, thanks very much, Chair, and echo the sentiments that many have already expressed. And Laura, I just wanted the opportunity to say, you know, thank you for the work that you've done here, but particularly just to highlight that part about social prescribing for our children and young people. You know, we've talked just now about the impact that the pandemic's had in so many areas, and of course it's had a profound impact on our children and young people. So it was really just to be really supportive of that suggestion of bringing back that paper to the board, you know, for a full report really regarding the social prescribing and the opportunities that presents to help deliver that service for our children and young people. So really supportive of that direction of travel. Thank you.
Great, well, thank you. If there are no further comments or questions, we'll move on to the recommendations. We have here recommendations 2.1, 2.2, 2.3 and 2.4. Are we happy that those, if we have a show of hands, to agree to those recommendations? Yeah. That's all in favour. Great, thank you very much indeed, Laura. I got it right that time. LT. Okay, moving on the agenda now to item 6, which is Shropshire 22-27 Joint Health and Wellbeing Strategy. Val, to you.
Thank you, Chair. Yeah, I'd just like to give a report on the final strategy. As has come back to the board before, when we have the draft strategy and discussion around with the board and wider people, the Joint Health and Wellbeing Strategies are a statutory duty of health and wellbeing boards, and this is the final document. So the draft strategy went for public and stakeholder consultation, and we used a mixture of an online survey, but also through attending partnership boards. We had a learning and physical disability adults group. They engaged with questions around the strategy. We also went to different partnership boards, such as the Mental Health Partnership Board, Early Help, Carers Partnership Board, and we had 172 responses to the surveys, most of which, while 85%, are members of the public. We recognise, so this was about 350 people overall who gave their views. I know this may seem relatively small, but it's a big ask to be looking at a strategy, and actually I think I feel that is pretty good amount of people overall. You know, work is ongoing through the implementation, and I'm sure getting lots of views back and feedback about how it's going through the strategy as well. So that's another opportunity. We are also doing ongoing work with children and young people with engagements. So again, that will feed into the strategy progression. Just want to say, really grateful to Shropshire people for giving their feedback. You know, it does take time, and we're very grateful to those who either took time to speak to us at partnership boards, said, you know, asked their volunteers to talk to people in their groups, and the public and stakeholders who responded to the survey. So from this, the report was published, which is on the Shropshire Council website, which is the findings of the survey. I won't go through that in detail because I've just summarised that. But what came out were, for the strategic priorities, there were things that needed greater reference. So in terms of, I'm not going to go through all of this, but reducing inequalities, disabilities, housing and digital by default came out as concerns, and of course the impact of financial pressures, which obviously we've seen with the impact of COVID. And down just picking key priorities, healthy weight and physical activity, food and exercise costs, mental health access and waiting times, and stigma came out through the findings too. In workforce, low wages and lack of opportunity, such as young people leaving the county because of lack of opportunities to progress. Other areas, key areas in terms of priorities that were cited as missing were substance misuse. We had alcohol in there, but also substance misuse was saying that really needs to be in, and also safe active travel and safe roads, and a greater reference to loneliness and suicide prevention. Suicide prevention is one of the priorities, but you know, I've put that in there because people were you know, actually stressing that. The vision we put for Shropshire people originally was to be the healthiest and most fulfilled in England, and feedback from that was that is perhaps pretty ambitious, and is it realistic? So that has been changed to for Shropshire's people to be healthy and fulfilled. In the report, it gives the key changes, which is on a page just for ease of reference and for people to see. And what's happened with these is these have been weaved into the final strategy. So next steps in terms of the strategy are the Healthy Life Steering Group, which is the prevention programme of the Health and Wellbeing Board. Those meetings have restarted and those priorities are going to start coming through that. There'll be a project management approach to priorities. So this is right, what are we going to do in terms of implementation? But again, we know that joint working is absolutely key to that. You know, we all have our part to play. We know that, that's why we're all here. And that's going to be absolutely vital. And also in terms of the different priorities, forward agenda planning will ensure that the different priorities are reported on a rotational basis, so that everything we're saying is a priority in that strategy, there is some form of reporting on that. So in terms of recommendations, I'll just scroll back. This is that the board agrees final 2022 to 27 joint health and wellbeing strategy, and we take joint ownership for progression and implementation. And Healthwatch reporting will start coming back to the board as well, so that will be another reporting mechanism. So thank you, that's it, Chair.
Thank you, Val. Are there any questions or comments for Val? Yes, Kirsty.
Sorry, I just wanted to say thank you to Val for a comprehensive report, and just looking at figure 1 as you put at a glance, I just thought it was really great to see all our priorities and everything that we've discussed over the last few months, obviously since me being a new member of the board. But interestingly, you put what we've got to keep a focus on, which is great to see the children's mental health in there, and then you know, on the right hand side of that figure, what we've got to look at and change, and I thought that was really helpful as well. So it gives us a focus and priorities, and thank you for everything that you've done.
Thanks.
Are there any other comments or questions for Val? Yes, Penny.
Thank you. Can I just say, can I just echo that, please? Val has done an enormous amount of work on this, and she's really worked hard to include the views of all our partners and people. So yeah, thank you very much, Val.
Great. Okay, it's all congratulations to
ourselves.
Start today, isn't it? Jolly good. Right, we've got the recommendation there. Are we happy that if there's no objections that we accept those recommendations? Yeah, that's great. Thank you very much, Val. Moving on to item 7 on the agenda, which is the oh god, I'm going to trip over this now. Musculoskeletal transformation program. I think I got it right, did I?
Yeah.
Okay, thank you. That's Terry. Terry, hi Terry, welcome.
Hiya, nice to meet you. Can you hear me?
So, yes, yeah, we can hear you if you'd like to present your report.
Hi, yes. Hopefully you've received our presentation in your packs. I'm just checking. Yes, brilliant, thank you. So we're just here to present today, which is on the Musculoskeletal, MSK for short, transformation programme, which is happening both across Shropshire and Telford and Wrekin. You can see in the pack that we've given you an overview of the programme, some of the key data and the next steps. This is very much about a vision around ensuring patients can receive the right care at the right time, first time in the right place. And at the moment we don't have a standardisation referral route or anything for our citizens. So we're trying to make sure that our outcomes are the same wherever you enter the services. So we've put in the pack the reasons for the change, which is on slide 2. I won't go through each of the slides because I presume that you've read them and can see where they're up to. You can see that it impacts a large element of our populations, and we're very much focused on citizens' journeys through our MSK services. And we've done quite a lot of patient and public engagement through surveys and patient groups to instigate what model that we should have in place that meets their needs, really. So that's our reasons for change. You will note from slides 3 and slides 4 that we are phasing the programme. Year 1 is very much focused on what we would describe as the front end of the patient's pathway, so how patients are referred. At the moment, patients can enter our MSK services through lots of different doorways, for want of a better word, and we're suggesting that one single point of access to ensure consistency in care would be much better, and that's the feedback we've had from our patients. Also helping patients to manage their conditions much better and working much more in multidisciplinary methods. So in phase 1, that we're focusing very much more on the front end. As we move into phase 2 and 3, that's focusing on orthopaedics, outpatients and primary care and working through. You can see on slide 5, we've presented what the benefits would be. As you can tell, the main element of this is a much more joined up model of MSK across the whole Shropshire, Telford and Wrekin, one referral pathway with a point of advice and guidance for everyone to access, much more oversight of patients so we're able to impact on any inequalities or issues that need addressing, a triage team that will be made up of different specialists so we can ensure that patients are directed to the right service at the right time, and much more passing of information through those services, and hopefully that people will have earlier access to therapy support. Hopefully that sets out the benefits. And what's happened so far, this has been work that's been ongoing. I picked up this work in March 21 when it was already underway. We've called it a transformation programme. There is a number of partners across our system that are working together to ensure our patients get the best service. We're starting phase 1, but obviously due to the impact of COVID, particularly Omicron, we've had to slow our implementation date, but we plan to implement this year. As you can tell, we've been working with Healthwatch colleagues and representatives to make sure that the views and experiences of people who use our services are included to shape those programmes. That's included both surveys, as I said, going to patient panels. Also, we've done some process mapping and testing those process maps with our patients. What we see is that actually how it feels for you piece. And then on page 7 of the pack is the roadmap. So obviously, because we're making some changes to services we're presenting to you today, I hope that gives you all the information that you would need, but happy to take any questions.
Right, thank you, Carrie. Do we have any questions at all for Carrie, or any comments or observations? No, right. Well, thank you very much for that, Carrie, for the report. So, I accept the your report. Thank you. Moving on to item 8, which is uptake data for childhood routine vaccinations. This will be Stephanie. Is it Steph?
Hello, yes.
Ah, hi, Steph. Yeah, right. Okay, Steph, if you'd like to present the paper.
Thank you. Okay, so we're bringing this paper back to the board today. It has been brought to the this subject has been brought to the board previously, and this is just by way of assurance.
Sorry, I wonder. Sorry, just interrupting you 1 sec. Could you share your screen?
If not, I'll
The document. If not, it's okay. We'll get Val to share. I'm just thinking. I haven't been making sure that the screen.
I don't think you've got that presentation.
Have we not? Oh, uptake for childhood routine.
It's a report.
It's a report.
It's a written report by way of assurance, Chair. I can try and upload it, Val. I don't know if you could do it your end.
Yeah, I think. Sorry. It's not a presentation, is it? No, it's a paper.
No, it's okay. Sorry. Yeah. Okay, carry on.
Is that okay? Thank you. So The paper has been brought previously in terms of measles, mumps and rubella is not a new topic. However, you may be aware in the media it's been quite fronted as of late, and it's a very important topic around the need to promote the uptake of vaccination for measles, mumps and rubella. Measles is a potentially fatal illness and can affect children, and does affect children, and we previously had achieved some elimination statuses nationally. However, following the pandemic, we've seen an increased decline in the number of parents and carers taking their children to receive their MMR for short vaccines. So the Office for Health Improvement and Disparities, OHID, and the UK Health Security Agency, the UKHSA, have launched a new print campaign which was launched in February last month, and that runs until the 14th of March. And there is lots of promotional material and resources available on the back of recent data which shows this decline in the number of vaccines and the uptake from parents and carers encouraging their children to take this vaccine. So the aim of this report is to hopefully support the increase in the number of people getting their children vaccinated for MMR through boosting parent and carer confidence through promotional materials such as these. There are a number of children as well, it's worth highlighting, who have received maybe just one dose of the MMR vaccine, which means they will only be partially vaccinated against MMR. So there is a call to action to encourage parents and carers to contact their GPs, make an appointment. If their child has missed their first or second dose, they need to be encouraged hopefully to go and get their next one. So there is a need for that as well. So just to give you
looks as though we've lost
oh, am I in?
Yeah, you're back with us again.
Oh, I do apologise. Where did I cut out?
You've only cut out a little bit, so
oh, yeah. I do apologise. Just to give you the important data is that the England target for both MMR doses by the age of 5 years is 95%. The latest coverage figure for England is 86.6%. Shropshire are exceeding this target with reporting 91.2%. However, we do have an MMR elimination action plan in place, which was drafted in 2019 for Shropshire, and some of the targets have been achieved, but there is still some further work to do. So at this stage, attached to the report, you will see the current data for Shropshire, and you will also see the action plan outline, and we are reviewing this at present, and some areas have been updated on the action plan, but it does need review. So we are just providing assurance that this is being done at present. So the recommendations for this report that we would like to bring to the board today are for the Health and Wellbeing Board to please receive and note the content of the report and support the action plan and work being carried out to improve awareness. And members of the board are also pleased asked to act as champions within their services and communities to further raise awareness and encourage immunisation uptake. You can do this by the recent campaign that's been launched by the UKHSA and using their resources and promoting them as wide as possible, please.
That's fine, thank you very much, Steph. Do we have any questions or comments for Steph? Yeah, Kirsty.
Hi Steph, thank you for a really comprehensive report and all the information in it. I do know though, and wholeheartedly support the recommendation by the way, just a couple of actions maybe for the board to consider. So I'm just scrolling down. If you look at your actions, some of them are as recent as like 2-3 weeks ago. I wonder if we could bring this back to board too, because a lot of these ambers are only just recently reacting, so it'd be good if we could see how you're progressing, if that's possible, Val. Just moving it down, thank you. Because there's so much recent work, which is absolutely fantastic. And just for ease, could you share the link with us for the comms? Is that possible for the campaign, so we can share it?
Yes, absolutely.
Thank you very much. Thank you.
Thank you.
The link, I think, is actually in the paperwork as well, a list of background papers. Okay, yeah. Sorry, yes, go on. John, did you like to?
Thanks very much, Steph. Thank you. And I appreciate from your comments that the action plan is something that's being refreshed and worked on at present, which is good. Just looking at the numbers for Shropshire, if my maths are right, it's roughly about just under 9% of a total cohort of 805 individuals that have yet to receive a full 2-dose regime, and that I think would add up to roughly about 72 individuals. And I just wonder, is there any work building on the success and the experience we've had in targeted and individualized approaches that we've taken through the COVID vaccination program, really looking at a targeted individualized approach to increasing the uptake, and whether we've got learning that we can introduce, that we've gained over the last year, that we can introduce into this program. I mean, I fully support having an action plan, because obviously we need an action plan to maintain high levels, over the future as well. But whether there's an additional piece of work here that would dovetail with the action plan.
I absolutely agree that a targeted approach would be definitely something we could consider, and I think as part of our action plan and reviewing, we need to get professionals around the table and the right people to discuss our next approaches and how we move forward with this. And I think a targeted approach, and there is absolutely going to be some fantastic learning from the pandemic that we can use. So I think as we review our action plan, that is something, and I'm grateful that you emailed this over in advance as well, and it is definitely something we can consider and as a group look at how we could possibly take it forward. And I think, when you break it down to numbers, it does speak volumes, doesn't it? It really gives you a better picture. So I'm very grateful for you working out the maths as well, in relation to the population. So I think, yes, that is definitely an action to note. And as we move forward and review, would be very much considering that and looking with partners as to how we can possibly work towards a targeted approach and use some of that learning. Thank you. Is that okay, John?
It is. Thanks very much.
Thank you.
Penny.
Thank you. Yeah, and just to come in on that, I think the vaccination programme with Bob the Bus is still ongoing at the moment, and it's working across our community outreach team, along with the NHS, and the conversations are happening around what we do next and how we continue to work with our communities, because it was so successful, exactly as John said, around how we take that learning and apply it to other things. So I think, Steph, if we get together and connect you with Hannah and Saskia, who are working on Bob and Basil, I think there's a lot more we can do there.
Or Basil and Betty.
Yeah,
absolutely. And I think that, yeah, that is going to be key, isn't it, as we move forward? So absolutely.
Right, well, if there's no further questions or comments, are we happy to accept the recommendation as printed on that the Health and Wellbeing Board to receive and know the contents of the report, support the action plan and the work being carried out to improve awareness? Members of the board are also asked to act as champions within their service and communities to further raise awareness and encourage immunisation uptake. The recent campaign launched by the UKHSA should be supported and content shared by the appropriate professionals to encourage uptake of MMR vaccines in Shropshire. So we're happy to accept that. So that recommendation has been accepted. Thank you.
Thank you.
Thank you very much, Steph. Right, move on to item 9 now, which is the COVID verbal update.
Thank you very much, Chair. So there is a paper that will be sent round after, and Val's just going to pull up on the screen, which gives the most up-to-date figures in terms of where we are. So what I just want to do is give a bit of a current position in terms of the data, and then kind of summarise where we are with COVID. So in terms of overall numbers, we have seen in recent weeks, and you can probably see from the slide that the numbers have started to fall from a peak on the 4th of January, a very high peak on the 4th of January in terms of the number of cases. We still have about 1,000 cases a week. Even yesterday we had over 230 cases that came in, so COVID has not gone away, it's still out there in our communities, and we've got a rate of around 100,000 at this moment in time. That we do still, as Mark said previously, we do still have a high number of COVID cases within our hospitals. Now that doesn't necessarily mean we've got people, because the vaccination is doing its job and we are keeping people out of intensive care, but we still do have people in our hospitals with, and these figures when they're produced will be updated figures today. We still have 51 patients in hospital who had COVID. We still have a large number of cases in our care homes as well, in terms of the actual numbers of cases and the number of in those homes and where we're managing outbreaks. Now again, those are starting to fall and are being managed very, very closely by the teams to support care homes. But we are still testing in both care homes, in our hospital settings, and where we have vulnerable patients. And it's important that we do continue to have high infection control measures in those settings. So the fact that we do have COVID still in our communities does impact on our services, because we obviously need to ensure that we support good infection control, etc. in those settings. So overall, an improving picture, much improved than earlier in the year. We are starting to see a fall. The vaccination programme has gone exceedingly well across Shropshire, with over 86% of people having their booster, which is meaning that we are having less severe disease, which is really, really positive in terms of this variant. So we will continue to monitor the data, but also I have to caveat that with obviously changes to testing programmes that mean that not as many people are testing. Yes, we are in vulnerable settings, so our hospitals, our primary care and our care homes will continue, and our social workers will still continue to be required to test because they're working with vulnerable patients. But by and large, those people with children, young people and others are not being required to test in the same way. So we will see a decline. I think so. The overall message is that our numbers are improving. The vaccination, and we're still encouraging everybody to get vaccinated, is holding. But I think as we move into this next phase of COVID, we will see, and it's not when, it's when it's not if, it's when we see future variants. We do expect other variants, and they may not be have as mild symptoms as Omicron. So as you would expect, we continue to monitor that very closely. So we are moving into a new phase. We are the government's called living with COVID. I would call it living safely with COVID. As we move to manage COVID as we do with other respiratory infections, it's really important that we continue to monitor, and there will be ongoing surveillance so we understand what's happening in our communities. Particularly, I come back to vulnerable settings, protecting the most vulnerable within our populations, of which we know we have many in Shropshire, and that is both people who've got clinical need, but also some of our target populations where we've seen really high rates and an impact of COVID in those populations. So we will continue with that. We will, just to assure the board that we will have surge capacity. We need to be ready to respond when new variants come. If they are more severe, we need to respond. We will continue to work and protect our high risk settings and work very closely with those. And our focus will become much more on prioritising those who are at risk of serious harm, and therefore reducing the burden on our care sector and on our NHS, and obviously on individuals, and focusing on comms and engagement. So we're moving into a new phase of the pandemic, where whilst the legislation that surrounded the pandemic will be removed, there is still an expectation, there's still guidance and recommendations there that we recognise that COVID is still out there, that there's still guidance and best practice around vaccinations, around wearing masks in enclosed spaces, around testing for vulnerable settings, that we would encourage and support people to adopt. Not just now, but as we've already talked about, particularly as we could move into next winter, these measures that we've learned through COVID so strongly will help protect us not only from COVID but from flu and the other winter illnesses that we know will be coming. So I think I just kind of wanted to finish on that, to, positive news that we are seeing rates falling, but we do still have a high level of COVID out there in our population. So asking, as the move is more that people take responsibility themselves rather than that we impose legislation, which is a positive move forward, but actually asking people to remember those measures and to use those, particularly in those more vulnerable settings. And I will end with just again a thanks to everybody and to our public who've continued to support us over these few years and helped protect our most vulnerable, and obviously the impact that has. So, but yeah, just I'll pause there for any questions.
Fine, thank you very much, Rachel.
Just hope that all the good work that the staff, everybody has done and the public have done doesn't go to waste now that sort of we don't want to take the foot off the accelerator. You know, to make sure that we carry on with the safe procedures, hand washing, that sort of thing, keeping distance. Okay, are there any questions at all for Rachel? No? Right, well, thank you very much. Thank you very much for that further update, Rachel. Moving on to my chairman's updates. Closure. The updates I got is notification changes to supplementary opening hours for Boots Pharmacy in Shropshire, Telford and Wrexham. The details of which have been included with the agenda, and also the correspondence from NHS England Primary Care England received relating to changes of ownership from CG Murray and Sons Limited at Northgate Health Centre, Bridge North, 49 Bullring Ludlow Medical Centre near Lane, Archie to the PCT Healthcare Limited. And then also from the 4th of January 22, the pharmacies at Unit 2, Picton Heath Shopping Centre, off Fangord Road, Vaughan Road, Clibby Mortimer, Church Street, Bishop's Castle, and adjacent to Radcliffe Green Surgery. Those pharmacies will now be operated by Avicenna Retail Limited, and so those lists are already included in the agenda. Right, so if I can thank all members for attending, we'll now move on to our workshop. Oh, sorry, Lynn, I beg your pardon.
I just wondered, Chair, if it was possible for me to give a Healthwatch update to the board regarding the work that we've been doing, but also our plans for the future.
Yep,
That'd be okay.
Certainly, yeah, that's fine, thank you.
So I just wanted to let the board know about a few things. So at the moment, we're doing a hot topic on the IAP services, the Improving Access to Psychological Therapy service, as part of our priority looking at mental health across the system. So we'd like support in promoting that, encouraging people to take part in that survey. And that includes people who may have not actually been able to access the service as well as those people who've used it. I also wanted to say that we're continuing to be involved in the work of the MSK transformation, and we did support the survey that was rolled out, and we used it as an opportunity to follow up on a previous piece of work we've done about people's experiences of pain management services. So we'll be reporting on that shortly. We're also hoping to bring the Children and Young People's Crisis Mental Health Services report that we've recently published to this board. So if you could consider whether or not it'd be appropriate for us to bring that report, that would be great, because really that's part of a much longer programme of work that we're hoping to do around children and young people's mental health. The other thing I wanted to mention was we are in the process of planning for an annual event. We haven't been able to do this for the last 2 years for obvious reasons, because for me that event really needs to be a face-to-face event, and hopefully going forward we'll be able to make it a hybrid event so people can join us online if necessary. And the focus of that annual event we're considering is end of life, and that's partly as an opportunity to remind people of our previous reports into end of life care, but also in recognition of the work that's been done as part of the CCG's review of end of life, which we've been part of through a group called Growing the Conversation. So hopefully we'll be working with the system to make that event a really informative event, so people understand what they need to consider when they or a loved one is coming towards end of life, and a real opportunity to talk about what is already happening, but also the improvements that are being made across end of life. And then finally, I just wanted to speak to the board really. At the moment, Healthwatch Shropshire is planning its priorities for 2022 to 2023.
And as usual, I base our priorities on those at the Health and Wellbeing Board, but also the ICS and previously the CCG. So I would welcome any thoughts from stakeholders about what our priorities should be this year. And we certainly have some views from the meetings that I go to, but I just wanted to give people the opportunity to speak to me about what they feel we should be focusing on this year. So thank you.
Thank you, Dave. Do you want these sort of that feedback now, or to give members of the board the chance to digest that and come back to you with it?
I'm happy either way, Simon. I realise that people might want to have a think about it.
Yeah. Okay, that's great. Well, look, thank you very much for that then. So we now, as I say, that's the end of the public meeting. Board members will be reminded for remain for a workshop, so I'd ask that those present remain, and those online rejoin by the link that's been provided by Val. Okay, thank you to all those who have listened in and participated in the meeting today, and I now declare the public meeting closed. Thank you.